unmuted myself. Yes.
Okay.
Yes. Thank you very much for inviting me to this discussion, and I look forward to the very interesting debate. Yes.
Yes, the question is definitely, as the presentation of Alexandre Lourenço just showed, is have you got the feeling that at EU we can now have a further, more decisive role in the recovery? And how could that be in terms of making the healthcare systems in Europe organized as a one?
May I make a comment on that front?
Yes, this was for Ioana Gligor.
Oh,
Gerard, can you hold that for a minute?
Sure, no worries.
Well, I think we cannot, even with the crisis, we cannot really change the treaties. So the Article 168 of the treaty says that health is a national competence, and the European Union is supporting the health authorities in this. And this is what we are trying to do. Either with, for instance, the joint procurement, with supporting, steering the debate at different levels, and working very closely with the member states. And I would just like to give you the example of the e-health network. I was counting today with in my folders, we had 11 meetings with them since the 25th of March. Normally we have 2 meetings per year, but it has been a very, very active period in which we worked very strongly with them on the toolbox for the apps, for the tracing apps. And we are trying to support as much as we can the member states in building this common approach and making sure that even if we cannot build a European health policy, because the treaty is quite clear on that, we are trying to build as much convergence as we can. On the other hand, we are also working with member states in several workshops on the European health data space, in looking what are the obstacles to the implementation of the GDPR and the use of data. And we hope that soon we'll also start the support for a code of conduct that, as you know, has to be developed by the organizations on the ground, and we will support this very closely. And also we'll try to support even more the setting up of a governance structure for the data spaces and for the European health data space, and building the right infrastructure in order to make sure that the data is better used, both by the researchers but also by the health authorities. Because what we have seen also now in this crisis is that the health authorities, they don't necessarily have the data that they would need in order to do the right analysis and to do the right decision makings. I think there is a lot of work going on. Our cycle in better regulation is not necessarily the speediest in the world, I must admit, in European Union, because we need to have strong proposals that take into account the views of all the stakeholders. So at EU level, we can't really make a law over the weekend, as it has happened in many member states. But what we try to do is to make sure that we are supporting the member states. We are building as much consensus as possible, and we are trying to support the member states to develop the policies in the right direction and to come up with a solid proposal, non-legislative, legislative, and to build the right infrastructure for supporting the better use of data to fight the crisis and to prevent what has happened in the current crisis.
Thank you so much, Ioana.